guys, happy Friday. This is your Greer Plastic Surgery Friday Facebook Live. And today we're going to be talking about facelift or neck lift under local anesthesia. This is a question I get a lot from patients because they don't necessarily want to be completely asleep for something that they consider cosmetic, which, I mean, it is cosmetic. So let's talk today about the different types of anesthesia, what they involve, and when I would recommend doing surgery under local anesthesia versus general anesthesia. So first off, types of anesthesia. First, there's general. That's where you're completely asleep. You may or may not be paralyzed, but you're totally unaware of what's going on. When you're under general anesthesia, your airway does need to be protected. So that can be done with either a laryngeal mask airway, which is kind of it almost looks like a mouth and nose piece, but it actually sits on the back of your throat, or an endotracheal tube. And that's the normal tube that goes all the way down the throat that people think of. So that's general anesthesia. Local anesthesia is literally just a shot of numbing medication, so that's lidocaine. And then in between, there's this broad range of sedation where you can be lightly sedated versus heavily sedated. So for facelift and neck lift, when I'm doing a full face and neck lift, which means skin is lifted all the way up to here, and on the neck, lifted all the way around. That's pretty involved. It's a 3.5-hour operation. You're laying with your head turned all the way to the side for the entire operation. So it's just uncomfortable and it's hard to hold still that long. I do all of my full facelifts and neck lifts under general anesthesia. And that's not only for patient comfort, but also because when we have general anesthesia, you have an anesthesiologist or a nurse anesthetist in there monitoring the patient. So rather than trying to do double duty and keep track of how comfortable the patient is while giving sedation, I can just focus on the surgery and doing my best job there, and there's an entire other person focusing on the patient's comfort and safety. Now, I will do a mini face or neck lift under local anesthesia with conscious sedation. And with that, the patient's awake and talking and aware of what's going on, but we give some medication to help you relax. So usually an anxiolytic to help you just not worry and not care, and then a pain medication. Then I still numb everything up. So I will do a mini facelift or mini neck lift. The difference with those is I'm only lifting the skin right here. So it's a much smaller area to numb. It's a much shorter operation, only about 2 hours, and it's much easier for somebody to sit through awake. So that is a fantastic option in some people. It completely depends on how much loose skin there is along the jawline and under the chin. I really don't ever do any sort of more involved procedure like that without at least some oral sedation, because it's just hard to lay still for that long. You're laying flat on your back. The needle for injecting the local anesthesia, it pinches, it's uncomfortable. So I always give at least something. The only time I do stuff under straight local is really if we're just revising a small scar, taking out a lipoma, things like that. So you can certainly have a facelift and neck lift under light sedation and local anesthesia. Definitely make sure you understand the extent of the procedure your doctor's doing, how far forward they're going to take the dissection, how much difference you can see along your neck and jawline, because there is definitely a difference in results between a mini facelift or neck lift and a full facelift and neck lift. And I've had many patients who are a great candidate for the mini version, and they do well and they have a really nice result. But if you really need a full facelift and neck lift, the mini is just not going to get you there. So make sure you go to somebody who's board certified in plastic surgery or board certified in facial cosmetic surgery. Not cosmetic surgery, but facial cosmetic surgery, just to make sure that you are in good hands. If you have questions about facelift or neck lift, whether under local or general, pop them in the comments. I would be happy to answer them. You guys take care and have a great weekend. Oh, and if you want to see facelift and neck lift before and after pictures, check out our website, greerplastics.com. Bye.